Hi, my name's Karen and I'm an occupational therapist in the pulmonary rehab team. I'm here today to talk about energy conservation and how that might help with your lung condition. So lung conditions, you can suffer with breathlessness and fatigue, and that can lead you to being restricted with your daily activities. So I'm going to share some ideas with you today. So looking at the 3 P's, that's prioritising, planning and pacing, and I'm going to talk a little bit about equipment just to help you around the house with your daily activities. So with prioritising and looking at the tasks you do daily, it's looking at what you need to do and what you want to do. So what we want to avoid is a boom and bust cycle. So trying to do everything all in one day and then not having any energy for the next few days. So that can restrict what you're doing day to day. So have a look at what you need to do and prioritise. Then we need to look at planning. Planning around what you need to do and what you want to do and what satisfaction you get. Maybe you're better in the morning or in the afternoon or in the evening. So looking at all the activities you want to do, but think about when you're best able to do that with your energy levels. So for example, if you want to go up and down the stairs and that's restricting you with your breathing, so then plan around when you're going to do that and how often you need to do that. Anything you need to have in place, say for a shower, get all your clothes together and plan what you need to do beforehand. So if you think about breaking down the task to more manageable steps, so for example, doing your breathing exercises, doing your pursed lip breathing, and do a few steps at a time and rest in between so that they're not getting breathlessness and they're conserving that energy. So I just want to talk a little bit about the equipment that can be used day to day. So it's not about taking your independence, it's about giving you back that independence. So for example, if you're preparing a meal, so you're going to plan, you're going to get all the items ready at a reachable level, and then perhaps you're going to struggle carrying them items from room to room. So maybe a kitchen trolley might help you with that. And it can also help with mobility to help you take one item to another room. You might be looking at taking a shower. So standing in the shower can take energy. So looking at the ventilation in your room and perhaps having some grab rails and a shower chair just to be seated, so you reserve that other 25% that you could potentially be using. So looking around at all the areas of equipment, so we can do mobility equipment, 4-wheel walkers if you're outdoor walking. We can look at dressing aids, so a lot of energy is taken when you're bending and reaching, so that restricts your airways. So looking at using some dressing aids such as a sock aid, a helping hand and a long handle shoe horn. So that can then stop you from reaching and bending and restore that energy. So some good tips to conserve your energy is looking at batch cooking, so preparing your meals in advance so you're not having to do that day to day. And if you're struggling with the kettle, think about using a kettle tipper. Just small things that you probably don't really think about. And then say if you're struggling with transfers, that can take your energy. So if your toilet's a bit too low, you could have that raised. You could then have a freestanding toilet frame to support your transfers. If you're struggling getting in and out of bed, then maybe you need a bed lever to help you with that. Anything there to help you from using that energy. It's looking at how you can do your day to day. So think about and plan ahead so that you're not taking all that energy that you need so you can perform all the activities that you want to do during the week. So a good place is to do some planning. So maybe you've got a calendar or a diary and you can just plan on there what you're going to do that day so that you've got those rests in between. One of the other things we look at is relaxation. So relaxation is to look at reducing your anxiety level, because when you're struggling with your breathlessness, you are a bit fearful and then you might hyperventilate or struggle with that breathlessness, when actually you can control that by relaxing. So if you just sort of sit down, just relax or lie down, play some music, some relaxing music, and just take a few minutes before you do an activity and just be in the moment rather than worrying and having all those concerns. Another area is looking at your breathing. So I mentioned about pursed breathing, and just before you're doing any activities, just concentrate on your breathing. So if you breathe in for 2, so expanding your lungs, and then just breathe out slowly as if you're blowing through a straw, and out for 4. So if you do that a couple of times, especially when you're doing the stairs, and just stop and breathe, that can help you with your breathlessness and just reduce those symptoms. I hope you found this useful today, and I wish you all the luck.